Lauren, resident biochemist at the Mineral Body, and today we're continuing our series on the 12 primary minerals, looking at biochemic mineral number 3 here in Australia, which would be iron phosphate, or ferrum phos. So why ferrum? If you've ever looked at iron on the periodic table, you've seen Fe is the symbol for iron. That comes from its old name, ferrum. So if you read older texts, when they're referring to ferrum phos, you know it's iron phosphate. And you know why Fe on the periodic table. So, keywords to remember with iron phosphate is inflammation, but also first aid. So this is generally the remedy called for whenever something acute comes up. So if there's been an injury, if there's been an acute infection, anytime there's inflammation in an area, we want to give iron phosphate first, primarily for the oxygen-bearing quality that iron has. So, iron, it carries oxygen in the blood and gives blood its red colour. So this mineral is responsible for both blood's red colour and its ability to hold and bind oxygen. So the levels of iron in the blood indicate how much oxygen, or how efficient we are at holding, carrying, moving oxygen throughout the body. So conditions where we're low oxygen at extremities, iron phosphate is going to be hugely beneficial. I would be taking it internally and applying it externally as either a cream or dissolving the tablets. You could dissolve the tablets in a foot bath as well. The cream would be an easy way to just lather it up, but either way, the foot baths are good because you can have it hot, which increases the absorbing ability of the body. And but do remember, the skin is an amazing organ for getting nutrients into the body through. 60% of what touches the skin is absorbed by the skin. That's going to make a lot of y'all cringe, but that's true. So be very mindful what substances you're using coming into contact with. We absorb a lot of that. Okay, so carries oxygen in the blood, gives it its red colour. Works best in alternation with number 4, which is potassium chloride. This is in terms of it being a first aid remedy against infections. For the infection fighting ability, you pair this with potassium chloride, which is a huge immune boosting element. These two working together are going to give standard infections a really hard time. And if you use these two minerals at the very start of an infection, it rarely progresses. If you can catch things early, use these two minerals at the acute rate, you'll get a handle on that infection in no time. This is how I handle infections now. So for detox and defense. So, the oxygen. Irritants, toxins, substances in the body, in the blood, that need to be broken down into smaller parts can be done so via oxygen. We oxygenate those substances into smaller parts, oxidize them into smaller parts, which can then be processed by the immune system. So irritants are oxidized into smaller parts and then neutralized through the lymphatic system. So we oxygenate the irritating particles with iron phosphate, and we boost the immune ability with potassium chloride. These two together are a very powerful infection-fighting, immune-boosting pair. You can take with number 7, magnesium phosphate, before and after exercise, as both are involved with muscle function, to both increase your ability. So this is fuel for muscles, so you'll be able to go a bit further for a bit longer if you pre-feed the muscles all of the minerals they're going to be burning during this process, and then you feed them again afterwards to ensure they have everything they need for repairs. This isn't specifically going to help with the lactic acid. For that, you would need the acid balancing mineral sodium phosphate. So iron phosphate and magnesium phosphate are an amazing fuel for, say you want to bulk up, grow muscle. This is awesome muscle food. Say you want to take the pain out of your workouts, make the lactic acid buildup a little less painful. I would apply a sodium phosphate cream or take some of those after your workout as well to just help your body's ability to break down those lactic acids, which are causing the pain after workouts. Some little tips and tricks for how to use those minerals. So iron phosphate is found in all cells, especially blood and muscle. So areas of application for this mineral: It's beneficial for anemia, low iron, beneficial for bladder infections, infections general, for bruises, prone to bruising, for bulimia, vomiting of undigested foods. That can be a tell for low ferrum phosphate, low iron phosphate. Bronchitis, susceptibility to colds, for cuts, any kind of acute injuries. Ferrum phosphate, increasing the oxygen levels in the body is going to increase the rate at which we can perform cellular activities. And cellular activities are increased once we are injured. So there's a signal of something's gone wrong, danger, impact, something's gone wrong. We need assistance, we need repairs. The body does not like having vulnerabilities. So when the epidermis, when the skin has been cut, opened, we are open to infection. So that sends out warning bells to the body. Resources are sent, oxygen is sent to that site to start performing repairs, cellular processes, whatever's needed to close up that hole and to regain overall integrity. So should this happen, onset of such a thing, I would start taking iron phosphate at the acute rate. You can dissolve a tablet directly onto an open wound to aid in the blood clotting factor and the knitting of the flesh. Make sure, obviously, hands are clean, site is clean before you go putting anything in or on a wound. Put it around the wound, not directly into the wound itself, but we feed the flesh, oxygenate the tissues. It's just going to help speed repairs. And again, that oxidizing ability aids defense, so it will help against infections as well at the site. Don't think of it as an antiseptic though, that's not the role it's playing. Okay, cases of fever, and there's a biochemic explanation for fever. I'll just call up that quote. So, this is from Dr. Wilhelm himself. Without proper balance of iron in the blood, health cannot be maintained. When a deficiency in this cell salt occurs, the circulation is increased as the blood tries to carry enough oxygen to all the tissues of the body with the limited amount of iron on hand. And in order to do so, must move rapidly, exactly as 7 men must move faster in order to accomplish as much work as could 10, moving at a slower pace. This increased motion, being changed to heat by the law of the conservation of energy, is called fever. In no other medical writings will so simple and reasonable a definition of fever be found as the one offered by the biochemic pathology. It is not the fever or heat alone that causes the condition of unease in the patient, but the deficiencies in ferrum phosphate and a subsequent lack of oxygen. This interference with metabolism, thus caused, soon prevents the functioning of other cell salts, with the results that they also lose their power of union with organic matter and are thrown out of the system. A deficiency of potassium chloride nearly always follows a deficiency in iron, unless the missing ferrum phosphate can quickly be supplied. Okay, so with that, any and all cases of fever, iron phosphate, and supply some potassium chloride as well, just to look after the glands and immune function. Fevers are no longer an issue. If the fever does run high, though dangerously high, then we would want to intervene with potassium phosphate. This one prevents against the degradation caused by excessive heat of tissues. This one, think of it like an internal. This one is more of the internal antiseptic, but this one prevents against the damages of the higher heats in fever. So inflammation anywhere in the body for the reasons we spoke about. Incontinence for muscle pains in general. This mineral is contained in high amounts in the muscles. The muscles use a lot of oxygen. Muscle aches and pains, sometimes if they're due to lack of oxygen, iron phosphate is going to be the cure there. For muscle weakness, for sprains, that's kind of in the realm of acute injuries. It's acute when it happens and chronic afterwards, I guess. But iron phosphate is going to speed the healing again. Anytime you want to speed healing, speed cellular processes, oxygen is the fuel for a lot of cellular processes. So for stomach infections, throat infections, infections general, anywhere there is throbbing pains, anywhere there's throbbing, think of iron phosphate, think of the blood, the oxygen. Generally, when there's any throbbing, there would be inflammation as well. They're pretty well tied together. So for tonsillitis, vomiting, and just a little note, taking vitamin C, you increase your ability to absorb iron by about 10%. Facial tells for iron phosphate. So there's a feverish redness. It's a redness accompanied by heat. You can feel the heat coming off that redness. Around the eyes, you might see bluish-black shadows to the eyes. Blue-black colour. In chronic cases, you will see indents here and here. We'd call that exhausted storage, when we actually have these indents in here. I'll have to let me find a photo. This is another awesome book. This one actually has photos of deficient faces. This. Has examples of the redness as well. You can see it in the ears. And another example of the exhausted storage over here. But this is a really good example of chronic low iron. Okay. Yeah. So the redness, the heat, the blue-blackness, and those indents all tells for iron. The tongue, there's not really anything overly obvious other than if the tongue is swollen, in which case it's quite a urgent, quite a severe deficiency, inflammation of the tongue. The casts, rusty coloured casts, indicative of iron phosphate deficiency, and coughs that are tickly or painful, irritated, inflamed mucous membranes. Iron phosphate will be helpful there. Other tells, warmth, movement, and exercise all aggravate. If we're low on iron, we're in that feverish state we spoke about, where the blood's having to move faster in order to get the oxygen where it needs to, which means our core temperature is going to be higher with low iron levels, which means we're going to be warmer. So warmth is going to be very aggravating. Any kind of movement or exercise, well, that's demanding we burn oxygen, and we're low on iron, so that's going to be aggravating. So cold compresses are going to be very soothing because our internal heat's too high. This is just going to help regulate. That's a tell for low iron. The pressure and throbbing will not be relieved by the cold. That's another tell. Alrighty. And again, this is one of the minerals used in the finer potencies. Seen to work best at the 12x, and so that is the potency that DHU tissue salts manufacture them in. And this is the potency I prefer using them in. So yeah, that's that for iron phosphate. Just an overview. To go in depth will require, longer videos, probably at least an hour on each. But if that's something you'd be interested in, let me know in the comments. We can do deep dives on the minerals. I'm just trying to do general overviews to make these minerals at least understood, the general functions, some of the keywords associated with, and some of the ways you can start to see these deficiencies in yourself and in others. Start to wrap your head around how to use them. Because this should be basic stuff. We should be taught this stuff in school. It's what you're made out of. Should be simple stuff. Anyway, thank you for listening. Let me know if you've enjoyed. Thanks.